about health reform is between something significant, public option, something less significant, no public option, or nothing at all. And the public conversation has to explore the range of options. And that will impact the debate. So when Adam asked me if I would come, I said, heck yes. Not only because I too am mad as hell, but because I have been and had for myself a town hall meeting. And people came, and the vast majority of them wanted change. And we have to make sure the realm of public options is, and the realm of public options I don't mean in the healthcare policy sense, but in the public choice sense, is in fact the realm.
Public option is bullshit.
I want to say two things about why I think health reform. I'll go as far, by the way, I'll go as far in health reform as anybody in the U.S. Senate or the Congress, and probably a little further. And I think that we've got to have this conversation. I want to tell you two stories about why I think health reform is so important and why I think we have to say and deliver the message that a public, I don't use the word option, that's going to get him mad. A decision to use the public realm to administer health care is at least as good a model, in fact a far superior model over our current model. I'll at least, I'll say the word single payer, cheer. Two things. First, I shared a van with a guy who owned an insurance company. We were driving from an airport. And the guy was telling me about his business. I was very curious about it, and I asked him about where the profit model came from. And I said, my understanding is it's not just from healthcare premiums, it's also from the premiums you invest, and you make money off the float. And he was explaining a little bit. He said, but you know, the regulators really want us to have at least a 70% loss ratio. And I said, being not as bright as I wish I were, what's a loss ratio? And he said, oh, that's the amount of money we actually have to spend in care. They call that the loss ratio. I mean, if I had a barbecue and the actual barbecue I had to serve, I called that the loss ratio rather than what the hell I actually did for a living. Second is more personal, a story I don't tell very often. My mother contracted breast cancer when I was in high school. She, just prior to that, was a member of an HMO, and her assigned primary care physician, no aspersions on doctors generally,